9. Now, I really like this. A National Volunteer Corps. Well, the NHS belongs to all of us. It's create a volunteer program where everyday people can assist with non-medical tasks, delivering meals, helping patients navigate hospitals, or simply providing companionship. Well, of course, we understand that people will need a level of training to do this, and many hospitals and many community health systems, even local GPs, do use volunteers from time to time. But I think it's a scratch on the surface of what's required. We need to systematize it. We need to bring in people who are retired. We need to not just take from these people, but we need to give them value by being part of a community effort. We could, for example, give them free meals for their volunteering. We could give them subsidized transport if they are going to volunteer at a hospital. Of course, it's not a full-time role, but there's so many people who are retired and bored and who are lacking community, or people who are unemployed. And of course, we don't want this to be replacing the important jobs. We don't want volunteer porters, for example, because a porter is a critical role within a hospital, and we need people who are fit and motivated and who are really able to hit a schedule, and who are contractually obligated to around privacy or we need people who are employed. However, there's so many roles that people could have. So if we raise awareness and create easy pathways for people to volunteer, we could mobilize communities nationwide. In a way, this needs to be a little bit like the moonshot that President Kennedy announced all those years ago. I forget the exact statement. I need to look it up. I'm going to do Kennedy's moonshot, because it was sophisticated. What he said was his goal to land a person on the moon and return them safely to Earth by the end of the 1960s. So that statement, that moonshot, why it was so powerful is because it encompassed so much. It's a singular goal, which is get someone to the moon and bring them back, return them safely to Earth by the end of the 1960s. So it had a deadline. But what it did is it got young kids interested in science and technology. It got a nation excited about this prospect of doing something so wonderful. Now, we've heard calls for curing cancer before, and we've heard calls for ending heart disease, and so many massive asks, frankly. What was simple about the moonshot was it was simple. It was go and come back. But what it did is it stimulated this fervor, this excitement, this vibration, not just in a nation, but in other nations that were around the world, because it was also a competition. And in a way, calling for zero waiting lists is probably not the most exciting of moonshots, but we've got to find a way. Almost, again, if we go back to that war mentality, the war, Second World War, I'm not talking about modern wars, but back then it was our nation needs you. And in fact, the First World War, wasn't it? It was Kitchener. But, and really it was about saving lives, and it was an existential crisis. But so in a similar way, we've got to bring people together, and we've got to make sure there is a benefit, multiple benefits for that participation.